Hey, what's up guys? This is Fab, your fabulous healthcare virtual assistant, and today I will be answering interesting questions from my previous vlogs about virtual assistant and Hello Rache. So if you want to know the answers to those questions, then keep on watching. So guys, I'm happy to tell you that we already made the 1,000 subscriber mark and I'm now able to post on the community tab. That's really important for me because I get to interact with my subscribers and you can comment on the posts that I will be posting in the future so that I could learn more about you and your needs. Just a quick announcement, Hello Rache is on batch 60 now. And if you want to apply, you can go ahead and check out the description box for the links and other information. So, ang ginawa ko is I compiled questions, interesting questions, and most frequently asked questions from my previous videos, and I will be answering them now. But before we go to the questions, I would like to make a quick shout out to a couple of people. Hello, Charlton Jao Mercado. Hi, Doc Mike Estur and Miss Charlene Monilias. Thank you for watching and for the support. Okay, so ano ba to? I don't know how long this video will take, but medyo marami-raming questions. So these questions are from my previous videos. I have a playlist if you're curious about those videos. Yeah, it's in no particular order. So yeah, let's start. Di ko na alam kung ilang questions to, so bahala na. Okay, question from Joella Marie. Hello, Miss Fab. This video is very helpful and encouraging. Thank you for making this one. I'd like to ask if they offer part-time. Is the 11 to 8 schedule really fixed? So there are two questions. One, if they offer part-time. Yes, they do. You can opt for full-time or a part-time job. That would vary on the number of hours per week. And all you have to do is just to inform the HVA managers that you want to be part-time. The second question is that if the 11 p.m. to 8 a.m. schedule is fixed. That schedule is for the training. The office is based in Arizona, so we're following their time. And for the working part, it will really depend on where your client is. Like, they have different time zones in the US and there are different work hours per clinic. But most probably it's gonna be at night. So again, night shift. Moving on. From Arian Gaza. Hello there. Quick question. Will the salary be bi-monthly or it really depends with your client? In Hello Rache, you will receive it bi-monthly. So every 2 weeks on a Wednesday. And Hello Rache will bill the client every Monday, but you will get your salary every other Wednesday. So yeah, it's not actually depending on the client. From USRN Fam, hi ma'am, is there an age limit? Thanks. Checking the website, wala namang nakalagay na age limit. As long as you can work the computer and you have the medical background knowledge, I think it's good to go. And based on my experience, I think I had a batchmate that is already retired. So she's a medical transcriptionist and she just retired. So, but she still wants to work and yeah, kasama ko siya nung nagte-training. So yeah. Correct me if I'm wrong Just comment down below if I ever make like things. From Belle Agli, I'm sorry if I'm butchering your names, but yeah, pagpasensyahan niyo, I'm trying my best. From Belle Agliam, pwede bang hindi medical scribe? Yes. If you watch my other videos, you can see that the other tasks that you can be assigned to as a healthcare virtual assistant, just ask your HVA managers. From Joy Esteban, hi Ma'am Fab, okay lang po ba mag-apply ang buntis na HVA? Possible bang mag-hire? Thank you. Again, based from my experience, may co-trainee ako na buntis at that time. Ang advice lang sa kanya that time is to inform the client kung kailan yung due date niya kasi she needs to take her leave. So, yun. But to answer your question, yes, tumatanggap sila ng buntis. From Sophia Marie Orais. Hello po, may alam din po kayo na task or home-based jobs na pwede for student nurses? Right now, wala, but I'm gonna do a collaboration with another YouTuber for another virtual assistant job. So, if hindi kayo pasok sa medical or like healthcare virtual assistant, that might be a nice option for you. So, just subscribe to my channel and click the bell button so that you will be notified once I upload that video. Next, from Riza Sandra Corpus. Hi there, need po ba na licensed nurse for applying HVA? Thank you. Again, speaking from my experience, I had a batchmate who just graduated nursing. Since pandemic, the board exam is crazy. Recent graduate nurse. Kasama ko ng training. So, yeah, I think so. And, you know, it will always be a plus if you have done the license, if you know something about, if you work in the BPO industry, and if you have knowledge about the US insurance. From Juan Carlo Trinidad, question po, may technical check po ba? Ano po required na PC? Need po ba talaga ng 2 monitors? Dami questions, diba? For the specs, you can visit the website or I'll post the requirements here. Also, hindi naman required na dalawa yung monitors, but for me, it's easier to work with 2 kasi mas malaki yung workspace. And kung may technical check, yes, may parang computer audit or technical audit yung mga IT department. Yung IT department ng Hello Rache. So, titingnan nila yung specs ng computer niyo. From Raquel Jane Mata La Sierra. Hello, kailangan po dapat mag-make na ng introduction video for the client? Pagtapos na po ba yung training? Thank you and love your vids. Thank you then, ma'am. The introduction video, day 1 pa lang, pagagawin na kayo niyan. So, if you need tips on that, just visit the video I made. I'll post it here or in the description box. From Eric Zingapan, for Hello Rache, should we include in our video that we are HVA trained, even if I have not trained by Hello Rache? Pwede din siguro, but you can consult the HVA managers for that. But I think being trained by Hello Rache is already enough. Next question is from Jessica Rascal. If you can also share how you edit videos and make your vlog intro video. Thank you. Love your videos. If you guys are interested in that, I could do like how I made my introduction video. My awesome introduction. Proud of that though. Parang I'm trying to level up my vlogging skills. So, yun, the intro. And also, I want to help future vloggers. From Paul Wilfred, Australia. Hi, Miss Lair. Where did you get your ICD-10 codes? I didn't study ICD-10 codes. It's already in the EMR of the client. And you don't need to study it also. But you need to know how to search for the right diagnosis because during the training, you will suggest diagnosis to your clients depending on his assessment. So, hindi mo talaga kailangan i-memorize or pag-aralan yung ICD codes. Mamememorize mo lang in time kasi paulit-ulit na like hypertension, I-10, ganyan. Pero, not really necessary. From Edge Viernes, hi, Fabb. What if you did not pass the certification? If you don't pass the admin certification, hindi ka pa mabibigyan ng admin tasks. Yung mga na pumapasa na ng admin task certification, nabibigyan na sila agad ng clients kasi mas mataas ang demand for admin tasks or admin HVAs. I think pag hindi ka pumasa in both certification, you can take remedial classes. You can consult with your HVA manager on what you can do, and I think you can retake those certifications. From Risha Velasquez Ang, It's been 4 days and I still haven't gotten any response from my application. I really can't say what exact day. Ang dami na nag-apply and I can't assure you of the specific time. So yun, baka processing pa. So just wait for the update. From Mary Ann De Leon, hi, can I still apply while waiting for the other requirements like NBI diploma? The site is not allowing me to continue unless all are uploaded. For the NBI before, I think tumatanggap sila ng proof na you have a schedule for the NBI clearance. But again, before you apply, guys, complete all the requirements. Kung kaya ipasa sa inyo ng school through scan, you can do it just electronically now since scanned naman din yung kailangan ng Hello Rache. So yun, before applying, make sure na complete yung requirements nyo. Juan Paulo Balyaran. Hi ma'am, may I ask about contract? Is it a yearly contract? Well, actually, you will be registering with BIR as a business entity so that Hello Rache can contract with you business to business. You can register as a virtual assistant or, for me, a professional nurse so that my services are being availed. Ano ba? So, Hello Rache is like availing my services as a professional nurse. Hindi siya employee-employer relationship, but yun, contract-based. From Crazy Inigo, hi, Miss Fabb, is it possible for me to be hired kahit tagal ko na nag-stop mag-work? I want to apply sana. Well, kung may experience ka, ilagay mo pa din. But, again, kung marunong ka mag-internet and you still have the medical knowledge to function as a virtual assistant, as a healthcare virtual assistant, then why not? From Zing Naiga, is a pharmacy graduate not yet licensed can apply? Yeah, feeling ko same sa nursing graduate. They could also apply na if they haven't had the licensure exam yet. Maryland, hi ma'am, I've read all the comments. Expired na RN license ko. July pa appointment for the renewal. Would they still cater such? This has been a very informative video. Siguro for this one, you can submit your old license just to prove to them that you're licensed and submit them the schedule of your renewal. From Lucy Pernia, hi, thanks for uploading this video. Just want to ask if need ba na experience prior to apply sa Hello Rache, like hospital setting. It will be a plus, but I think hindi naman required. From Priscilla Agatha, hi, paid po ba yung training? I've said in my other video that training is not paid yet and you will start earning when you have your client already. From Juan Carlo Trinidad, kailangan po ba mabilis mag-type? Di po ako mabilis mag-type. Salamat po. Yeah, there's a requirement. If you're interested, I have a video about typing. Check it out here or in the description box. From RV Love, thank you, Miss Fabb. I would like to know if the job provides certificate of employment for RSA. They provide certificate of employment a month after you started with your client, and but I'm not sure if it's for RSA. You can confirm with your RSA coordinator by your school, assuming that you're also from UPM. From Katarina Margarita Aceves, ma'am, good day. Can you give us an idea about the salary range in Hello Rache? Thank you. Again, sa first video ko, in-explain ko na if you work for 30 hours and then at the rate of $6.5 in an hour, you will roughly earn like 38,000 per month. Well, again, it depends on your client. If the client needs you for more than 8 hours a day, then you will earn more. Personal experience, I've received like up to 50,000 per month. So, when I was in my admin task job. So, ayun, just to give you an idea. Ang range niya is like 38, 40 to 50. Again, depending on how many hours you've worked for the client. Medyo swertihan, kaya pray-pray na lang din kayo. Next question is from Jamie Lois Fabros. Thank you for all the tips. For the clinical protocol, will they discuss that during the training? What sources did you use po? For the clinic protocols, hindi kasi siya, parang knowledge-based. It's the protocol of your clinic. Kaya nga siya clinic protocol. So, parang like hospital protocols, it differs from a hospital from another hospital. So, parang ito yung kalakaran ng clinic nyo. So, all the decisions, all the things that you will say to a client will rely on your clinic's protocol. And for the training, yes, they will discuss the clinic protocol, so pay attention to that class. Don't miss that class. That class is very important for admin tasks. From ASP channel, during training po ba kasama po ang typing speed? Yung typing speed, ina-assess siya sa training, pero there's no specific training for the typing speed. So, again, if you need help, I suggest you watch my video. From Christina Melissa Mendoza, hi Miss Fabb, I'm done with both live cert and phone cert. What to expect in our comprehensive? If you take down notes during your training, just review them. Comprehensive exam, review your Thinkific modules, and that's already okay. From Ere, is it always straight work for 4 hours, no bathroom breaks or anything? Pwede naman mag-CR. You just have to time it properly. For example, maghihintay for the next client, you can ask your client na you will go to the restroom. Pwede naman mag-break. From Faith Lingo, hi Miss Fabb, great video, thanks for sharing. I just want to ask something from what I've done. Sorry. Do VAs need to talk very often during the duty? Because I am planning of applying and I'm kind of a quiet person, but I love to just listen and to take down notes. Again, depending on your task. If you're an admin task, more of speaking. If you're live scribe, more on the writing. So, ayun. Yeah, I think that's it. Now I'm planning to differentiate admin from live scribing para matulungan din kayo on choosing ano ba talaga, if admin or live scribe. So if you want that video, please comment down in the comment section below. I love to hear your ideas. Thank you again for making me get this far. I appreciate every subscriber that I get. As in, yung face ko talaga nagla-light up every time na may nag-add sa subscribers number. Wala lang. It's me being grateful for whatever is happening in my channel. I'm so excited for the collaborations I will be doing. Nakaschedule na sila. And, give me more ideas so that I can make more videos and be able to help you guys. If you have questions, comment down in this video. Maybe I'll make a second part of this video. And thank you. Again, if you like this video, please give it a thumbs up, subscribe to my channel, hit the notification bell so that you will be informed of my future videos once it will release. Talk to me in my community tab. And I guess that's it. Thank you for watching this video. Hope to see you on the next one. Stay fabulously brave and beautiful.